Hello, everyone, and welcome to our module on child abuse and neglect. Let's start by talking about infant deprivation. Normal human development requires human interaction. Babies need more than just food and shelter. They need to interact with humans or the brain won't develop normally. So the term used to describe what babies need is attachment. Attachment means a child or a baby being repeatedly comforted and cared for. The caregiver consistently meets the child's needs, and the caregiver provides the baby with warm, consistent, loving attention. And this feature of child development is just as important as food and shelter. Babies need this or they won't develop normally. If there's a lack of attachment in a baby's life, this will lead to adverse effects on the child. First of all, children that aren't nurtured will fail to thrive. They won't grow normally. They won't develop normally, and later in life, they will lack social skills. And in extreme cases, this has been described in studies, babies can even die if they are deprived of social interaction. So once again, the key point here is that attachment to a caregiver is critically important for development of a child, arguably just as important as food and shelter. There are two DSM-5 disorders of attachment, and the first one that we'll talk about is called reactive attachment disorder. This occurs in children who have had severe early deprivation, and it shares some similarities with autism. So a baby who lacks attachment early in his or her life can grow up to have features of reactive attachment disorder which can look somewhat like autism. So the child will be detached, it will be unresponsive to caregiving, the child is often inhibited and does not want to show emotions and may be withdrawn and avoid. And this is called reactive attachment disorder in the DSM-5. The other attachment disorder we'll talk about is called disinhibited social engagement disorder. This is also a disorder of attachment. It's also associated with severe early deprivation. However, in this condition, basically children go the opposite way from reactive attachment disorder. These children have little or no reluctance to interact with adults. They'll hug strangers. They'll sit on the lap of strangers. This is called disinhibited social engagement disorder, and it is also a disorder of attachment. Now let's talk about child maltreatment, and this basically comes in four forms. Some children, unfortunately, are physically abused. Some are sexually abused. Some are emotionally abused, and lastly, there are some children who are simply neglected. We'll talk about all these in the next few slides. Child abuse is injury to a child by a parent or a caregiver, and this commonly affects babies. It's usually children under 1 year of age. If you've ever spent time around a baby, you can know that they cry a lot, they can be hard to console. Sometimes they cry during the night and they won't let you sleep, and in the right setting, unfortunately, parents will sometimes abuse these children. The perpetrator is usually the closest family member. Often it's the mother, or it can be the father or someone else like a grandparent who's caring for the baby. And often the child abuse is identified by healthcare providers who then have a responsibility to report what they've seen. Typical histories in child abuse cases are reported minor trauma that leads to major injury. So for example, if the parents say the child just slipped and fall, but there's a major fracture that looks like the child was hit or fell from a very significant height. That's the type of history you can see in child abuse cases. Another classic history is a caregiver history that changes over time. So they say the baby slipped, and then when you get the x-rays back and you ask them about it, they change their story. That's what's seen in child abuse cases. And then lastly, sometimes the severe injury will be blamed on siblings or pets. So the parent will say, oh, their older sister hit them or something along these lines. This is what's seen in child abuse cases. Bruising is the most common abuse injury. Often there are multiple bruises. They can be on the buttocks, trunk, ear, or neck. And remember, this usually happens to babies, unfortunately, and usually it's because the parents are trying to get the baby to stop crying. So they will hit them on the legs or on the back or on the buttocks, and that will lead to the multiple bruises. Fractures, unfortunately, also occur in child abuse cases. These are often identified through what's known as a skeletal survey. So if there is suspected child abuse, an x-ray will be performed of all the bones. And what this survey will often reveal in child abuse cases is multiple fractures in different stages of healing. So the idea here is that the baby has been repeatedly abused. So therefore there have been fractures, some of which are several weeks old, some of which are only a few days old. They're all in different stages of healing. Rib fractures are a classic type of fracture in child abuse cases. So are long bone fractures, especially in a baby. Sometimes babies get head injuries from child abuse cases. This is called abusive head trauma, or it's sometimes called the shaken baby syndrome. One of the classic findings is a retinal hemorrhage. This is a finding when you examine the back of the eye. This is a retinal hemorrhage shown here on the screen. Other classic findings are a subdural hematoma. Selected risk factors for child abuse are shown on this slide. Among the parents, some risk factors are single young parents. So remember that this is often a baby who won't stop crying and the parent just loses their patience. If you're a single parent, if you're a younger parent, this is more likely to occur. Same is true for low parental level of education, if the parent is abusing substances or alcohol, and if the parent has any psychiatric illness. Among the child, risk factors are an unplanned pregnancy. So once again, you may have a parent with a difficult baby that didn't want the baby. It's an unplanned pregnancy. It's an unwanted child. Other risk factors are a baby that has learning disabilities or behavioral problems. Once again, this just makes the child more difficult to manage and makes it more likely that child abuse may occur. Child sexual abuse, unfortunately, also occurs. This usually doesn't happen to babies. This is more common in children who are pre-puberty, usually 9 to 12 years of age. This is the demographic that tends to attract sexual predators. And the perpetrator is usually a male that is known to the child. If you ever had to read the book in high school or college by Maya Angelou called I Know Why the Caged Bird Sings, if you can just remember that story, that's the classic demographic for child sexual abuse. The girl in that story is pre-puberty, and she is abused by a male who is well known to her brother and her mother. Sometimes this is identified by healthcare practitioners when trauma to the mouth, anus, or genitals is discovered on exam. In addition, if you ever see a young child who develops a sexually transmitted infection, that's a classic history for child sexual abuse. Children can also be emotionally abused. This is sometimes called psychological abuse. So there's no physical violence or sexual assault, but the child is simply humiliated and scared. The child is made to feel worthless or unloved. There can be verbal abuse from a parent or caregiver. The child is frequently criticized, intimidated. This scares the child. Sometimes they are humiliated. And in rare cases, children are confined for prolonged periods as a punishment. This is all evidence of emotional abuse. Lastly, we'll talk about child neglect. This is a very common form of child maltreatment. 50% of cases reported to Child Protective Services are for child neglect. So in this situation, what happens is the parents don't physically or sexually or emotionally abuse the child. They just abandon their responsibilities and leave the child to fend for his or herself. So the child will have inadequate food, shelter, supervision, affection. The child can have poor clothing and terrible hygiene. And the child can also be underweight or malnourished. And in many med schools, they did this in mine. You will spend a day with Protective Services, and what you will often investigate are complaints that a child in a particular home is being neglected by the parents. This must be reported to Protective Services if you identify this as a pediatrician or a healthcare provider. All 50 states have laws requiring that physicians report child neglect so that Child Protection Services can get involved. Lastly, we'll talk about the vulnerable child syndrome. This is basically the opposite of child neglect. This is a parent who is excessively worried about their child, and this can have negative consequences on the child where they grow up thinking that they're sick all the time. This is a problem of parental reactions to the child, where the parents believe their child is highly susceptible to disease. The child may have a minor illness or it may not have any illness at all, but the problem here is that the parents keep worrying that something bad is going to happen to the child. And over time, this can lead to an anxiety disorder or some other psychological problem in the child as it grows up in this environment. Risk factors are parents with a difficult conception. So you can imagine that if a couple takes 5 or 6 years to become pregnant, when they finally have that baby, they may be constantly worried that something's going to happen to the baby. This is also associated with parents who have a difficult pregnancy or a postnatal period. If a baby spends 6 months in the NICU after he or she is born, you can imagine that thereafter the parents may always be worried about that child. This is also associated with parental anxiety or depression. And the way it'll be described in a board question is with multiple visits to providers and emergency rooms, often for numerous minor complaints. And if you go into practice in pediatrics, there will be some parents in your practice with this type of situation, and you will get to know them very well because one of the things you'll have to manage is their perceptions about their child and their susceptibility to disease. And that concludes our video on child abuse and neglect.